Thanks, Nadine. And first, can I just start out with a big shout out and thanks to our presenters. We had 3 great keynote speakers, but our presenters who did 4 presentations. Big thanks to Claire, Greg, to Puria, Rachel, and Annie. Great job. But also personal thanks, and this is off script, to Charlene Chi, who facilitated the wellbeing session. So thanks to that. In terms of your question, I think one of the key things, Audrey and I were talking before coming up, that we've actually got quite a big intersect actually with some of the themes that came out of the person-directed care and also the wellbeing session. And I think some of the themes that came out of the wellbeing session was very much around treating whether it's the person or the community holistically. And that it's not just about for example, quitting smoking or a particular service intervention. It was actually about the person, the whānau, the family and the community. And actually it was an essential part of actually getting amazing outcomes to actually start at that community base. I think some other clear themes, there's a very clear theme between an intersect between wellbeing and equity. And given the sort of uneven distribution of the social determinants of health at the moment, we're not going to be able to achieve health for all unless we tackle those determinants that sit outside of health. There was also a really big theme around the permissive nature that we need to create. So across all our 3 presentations, they achieved some amazing outcomes for their community and for individuals by working within a permissive environment. They weren't bound by service specs or contracts, and they didn't have to do a whole lot of widget counting. They were just given an outcomes and a focus, and they could be nimble with the ability to shift resources around. And another key thing we did here is that when wellbeing was very much about when people feel valued and included in the decisions about them.